Welcome back to HealthWise. With us is our special guest, Dr. Ty Hargroder with the Opelousas Wound Center. Doc, well, for those of you who don't know, Doc and I went to school together. That's why we're so comfortable around each other. We were good friends in school. Doc, tell us a little bit about the Wound Center and what you do over there.
Sure. The Wound Treatment Center at Opelousas General Health System, as you well know, is a world-class wound treatment center. We do very aggressive care. We do very mild care. A lot of the docs will refer wounds they're not familiar with handling, and it may require nothing but a small dressing, adequate cleansing of the wound. But we do a lot of more aggressive things than that. We do some major debridements at the wound center. We obviously have hyperbaric oxygen therapy, which many people are aware of. We use some specialty grafts, allografts, dermografts. We use negative pressure therapy, which is basically a little suction type device that removes proteins from the wounds, from chronic wounds that prevent the wounds from healing. And we use all of these things interchangeably as the wound progresses in different stages. One of the things that people don't realize is when a wound becomes chronic, no matter what you do to it, it won't heal unless you make that wound an acute wound. And the way you make a wound acute or a new wound is surgery. Number one, you can debride the wound to good bleeding tissue, and it'll start the process of healing again. That's similar to what the negative pressure therapies do, and similar to many of the dressings that we apply. There's no magic to this. We're taking a wound that is stagnated and is chronic, and either by application of certain chemicals or by physically removing dead tissue, tissue that has these proteases that prevent healing, we convert that wound into an active wound, and active wounds heal. And so that's really the concept. You know, it's a little more complicated than that, and it takes a lot of experience. You know, besides the 8 doctors that are wound specialists there, we have a wealth of knowledge amongst our nurses who've worked with us for years, who are hyperbaric trained, and all they do is wound care all day long. In fact, I look at the stats for last month. We did close to 1,000 wound visits last month at the Wound Treatment Center at Opelousas General Health System. And you do something over and over and over, you get real good at it.
Sure.
And so our nurses are excellent.
Sure. And it takes a certain kind of person to be a wound care, not only a doctor, but a nurse, because, you know, some people kind of get queasy, kind of get, you know, whatever. To do that kind of thing, they got to kind of want to do that kind of thing, because a wound isn't always the prettiest thing. You know? You're right.
You're right. You know, you say that, and our nurses are dedicated. We have very low turnover of employees. Most of our employees have been with us for years, many of them since the beginning.
I don't know, speaking of that, I've been kind of dealing with y'all for a long time, bringing patients, and I can't think of, you know, all of them seem like they've been there since the beginning. I really can't think of any of that.
We've had 1 or 2 over the years, for usually personal reasons, move on, either jobs that aren't, you know, don't have a call. We do have call. That's the other thing about our wound treatment center. With hyperbarics, we provide services 24 hours a day, 7 days a week for emergencies. Not all the hospitals do that have hyperbarics and wound treatment. You know, hyperbarics is indicated for carbon monoxide poisoning. The winter's coming, people have old heaters, you know, and a lot of times they put out carbon monoxide. So, you know, please, it's real cheap to run to Walmart or Lowe's or JB Sandos and get one of these little stickers that tells you if there's carbon monoxide in your house. But in the event that you get exposed to carbon monoxide, you know, hyperbarics is definitely indicated for that, and can really be a life-saving endeavor.
Okay. Well, let's talk a little bit about hyperbarics. A lot of people don't know what that is and what that entails. I mean, they hear about it, and they hear about people say diving. What exactly is that? You know, what is
hyperbaric oxygen therapy? Is the application of 100% oxygen under pressure, more than the atmosphere that we live under. Actually, we use 1 more atmosphere. We call it 2 atmospheres of pressure, to a person who's completely immersed in this oxygen. We call it a bath, but there's no liquid involved. The concept is you breathe this oxygen in under increased pressures. That oxygen does a number of things. The most important things that it does is it builds new capillaries, because of the difference between the low oxygen area in a chronic wound and the high oxygen area in the blood vessels. It builds new capillaries. And the biggest problem with chronic wounds, especially in diabetics, is their blood vessels are shot. So we build new blood vessels. It does a number of other things. It helps white blood cells move faster, helps them kill. I mean, everybody's seen the application of hydrogen peroxide to a wound, which we don't advocate, by the way. But, you know, that's the old treatment for an infected wound. The oxygen basically kills the bacteria. Well, we're using oxygen under very high pressures. It does a number of other things in terms of edema reduction of a chronic wound, which helps. If there's edema, you can't get nutrients to the wound through the blood vessels. You can't remove them. So not only do we build new blood vessels, we also remove the edema, which removes the physical barriers of transport of the good things to a wound and removing the byproducts away.
Okay.
So
now, you know, so basically, describe it for the hyperbaric chamber. I mean, I've seen it, but I know they haven't.
Well, it looks like a giant tube. It's a giant, looks like a glass tube, but actually is acrylic. We use monoplace chambers. There are other type chambers. We use monoplace chambers. Each end is basically capped with a door on one end. You lay on a stretcher, you slide in, they close the hatch. You can see through it. You can watch TV. You can hear. We have stereo. We have
speakers.
Thank you. Yeah, I was thinking headsets, not, but we have speakers in the doors. You can talk through. You just talk, and there's a microphone on the outside for us to talk back. We can run IVs through the chamber doors if we need to give you IV therapy, like antibiotics, while you're in the chamber. Typical dive times, you typically are treated for an hour and a half to 2 hours. And remember, the big concept I said is that we build new capillaries. We build new blood vessels. That doesn't happen with one treatment. So you're usually looking at treatment 6 times a week, usually 2 weeks, 3 weeks, 4 weeks, sometimes up to 60 days, depending on what we're trying to affect. You know, we've talked about bone infections before, osteomyelitis. Those are 6-week treatments, maybe 12 weeks. So.
Okay, well, so and it's not anything, you know, I see the people that go in there, and the biggest complaint I hear every now and then is about maybe an ear popping or something like that, or a little earache, and then I think y'all do put tubes in the ears?
Sometimes we do. There's some major contraindications to using hyperbaric oxygen therapy. One of the major contraindications is the use of chemotherapeutic drugs for someone who has cancer. It's not the cancer that's the reason not to treat people with hyperbarics. It's the use of the agents that the chemicals we use to kill cancer cells can be very dangerous. So we screen all of our patients very closely. The other thing is the fire hazard. There's a huge fire hazard. You can only wear 100% cotton garments inside a chamber. Anything else, nylon, petroleum products, when they compress with the pressure, they get hot. And we're always worried about a spark developing, heat sources, things like that, because this is 100% oxygen under pressure.
Flammable.
It's very flammable, extremely flammable. There's a couple of other contraindications. People who have spontaneous collapsed lungs, called a spontaneous pneumothorax. The pressure changes can cause a collapsed lung. That would be a dangerous thing in a chamber. So people with a history of a spontaneous pneumothorax, not trauma related, but just some people are at risk and just have them. Those patients we typically don't dive. We typically don't dive pregnant females except if they have a major indication. There's only a few major indications for hyperbarics where it has to be used for therapy. One is gas gangrene, a very dangerous infection. The other is the bends or decompression illness that divers get. But also remember, it's not just divers who get these injuries. If you're in a submerged vehicle and it goes into the water and it's under the water for an extended period of time and you're breathing the air in that vehicle, under pressure, you have a risk of developing the bends when you come back to the surface, just like a diver would. Radiation necrosis of the mandible. Patients who have cancer, have surgery, have radiation to their jaws, and then develop an osteoradionecrosis, or a infection of the bone related to the radiation, is a prime indication. A secondary indication for hyperbarics that many of the patients, we're in Cancer Awareness Month for October, Breast Cancer Awareness Month, is if you've ever had radiation to any part of your body and you need to have surgery in that part of your body, you won't heal normally because of the radiation damage. Remember, radiation damage is permanent and lifelong. It affects the DNA in our body. What we do with hyperbarics is we treat you before your surgery, and then we treat you after your surgery, and we improve the healing of your tissue to almost what it was prior to radiation.
Okay.
So those are some of the major indications. Now, secondarily, there's a lot of things that we use in conjunction with surgery and other treatments.
Okay. Well, we'll talk about a little bit about that when we come back from this brief break for our sponsors.